If you're experiencing hearing loss or ringing in your ears, commonly known as tinnitus, you might be wondering, should I try an over-the-counter hearing aid, or is a prescription device the better choice? Since the Over-the-Counter Hearing Aid Act of 2017 and the FDA's 2022 approval of OTC hearing aids, some of which I have right here, the market has exploded with options. But here's the truth. While these devices are more accessible, they're not right for everyone, especially if you're dealing with tinnitus. I'm Dr. Ben Thompson from Treble Health. I've helped thousands of patients improve their hearing and regain control of their lives. In this video, I'll walk you through the biggest differences between the over-the-counter and the prescription for hearing aids. We'll cover the cost, performance, customization, and the professional support that's often essential for success. So let's begin by distinguishing the two main types of hearing aids. We have the over-the-counter hearing aids, and we have the prescription hearing aids. Although they may look similar, the differences are significant. Over-the-counter hearing aids were officially approved by the FDA in 2022 as self-fitting devices, no hearing test, and no audiologist visit required. They're available online or at retail stores without a prescription. They generally cost between $200 a pair up to $1,000 a pair. They're intended for adults who are over 18 with perceived mild to moderate hearing loss. The OTC devices offer a low cost and accessible option. However, because they're not professionally programmed, they may not get great results for some people, especially with tinnitus treatment. Now, prescription hearing aids. The gold standard for hearing loss treatment is using prescription hearing aids. They're often tailored to your individual hearing profile, and they require a comprehensive hearing test that you would take with an audiologist. Prescription hearing aids are fitted and programmed either by an audiologist or a hearing instrument specialist. And prescription devices, the typical cost can range from $3,000 a pair up to around $7,000 a pair. And they're available for all levels of hearing loss, from mild all the way up to severe and even profound. They include follow-up care and support. And for patients with tinnitus, or also pronounced tinnitus, the customization of sound therapy and masking features in prescription hearing aids can be essential for that treatment. So I typically recommend inboard sound therapy during tinnitus treatment. The prescription hearing aids can do that. I found 5 key differences between OTC and prescription hearing aids. First is candidacy. OTC hearing aids are not recommended for people under 18, for children. They're not recommended for severe or sudden hearing loss. And for people who experience ear pain, dizziness, or ear drainage, in such cases, the FDA actually advises a medical evaluation before you purchase any hearing device. Second, technology and customization. OTC devices typically offer very basic frequency controls, so bass, mids, and treble, just adjusting some basic volume adjustments, only a few preset sound environments, whereas prescription hearing aids provide advanced fine-tuning options based on your hearing test data so that they can really be adjusted to give you the best hearing possible. Prescription hearing aids do a better job at adjusting to speech, making it more clear, and complex background noise situations. Prescription hearing aids give advanced tinnitus sound therapy features. So if you struggle with tinnitus, the added customization inside of prescription hearing aids is often critical and well worth it. Third, we have cost. So OTC devices, I'm seeing them come around $1,000 a pair. Prescription devices, I'm seeing them most commonly come around $6,000 a pair. The higher prices of prescription devices may include some advanced testing done by your audiologist, the expert fitting and fine-tuning, and the ongoing support that's included. Some studies have shown that for mild hearing loss, OTC devices can offer comparable benefits, but for tinnitus and other advanced hearing loss needs, I'd recommend professional assistance and I'd recommend prescription hearing aids. Our team at Treble Health actually provides the assistance. We're a team of audiologists, and the professional hearing aids would be our recommendation for a vast majority of people that come to us seeking advice. Additionally, let's talk about real-world outcomes. A 2024 study found that many OTC hearing aids did not significantly improve speech clarity in noisy environments. Other studies have found self-reported benefits from OTC and prescription users, but only for fairly simple hearing losses. If you have tinnitus or require fine-tuned support in complex listening environments, then prescription hearing aids tend to offer more superior outcomes. And finally, professional support. So with the OTC devices, you're on your own. You must set it up, adjust it, and troubleshoot the device yourself. With prescription hearing aids, you receive hands-on care from an audiologist, so getting the fitting adjustments properly set, optimizing the devices, using tinnitus sound therapy, programming, help with comfort, connectivity with your phone, other troubleshooting that might come up. For many people, professional support is what gives patients the positive result with their treatment. So which devices are right for you? If you're considering choosing OTC hearing aids, I'd like to see that you have mild to moderate hearing loss, you're tech savvy, and you're comfortable with the self-adjustment nature, and potentially you want a more budget conscious option. However, if you might choose prescription hearing aids, this is what I'd like to see. You have a hearing loss that affects you day to day. You may have some tinnitus ringing in the ears. You want to hear extremely well in places that are important to you, like restaurants, group gatherings, work meetings, places with background noise. I also may see that you want the absolute best hearing possible so that you don't miss a word. So if you're unsure about which hearing aid is right for you, or you're dealing with tinnitus, my team at Treble Health offers free consultations. We'll help you understand your options for treatment, what's available, and guide you toward the solution that best fits your needs. You can click the link on the screen right here to schedule a free consultation today. And if you want to learn more about the best prescription hearing aids available this year, click the link on the screen where you can check out my next video where I break down my top picks for this year. Guys, thanks for watching. This is Ben Thompson with Treble Health, and I'll see you on the next video.